gratification, a history of alcohol or drug abuse, and delinquent or illegal activities. So how do you help your pregnant adolescent client? Focus your attentions on the education for the prevention of pregnancy through sexual abstinence practices, prevention of complications, and resources for social and economic support. A thorough assessment of the client early in pregnancy will give you baseline information such as weight and blood pressure. Determining immunization status is important so that the essential prevention measures are taken and she is educated about the proper time to receive immunizations, such as the rubella vaccine or immunoglobulin for Rh factor. Assessing your client's understanding of pregnancy and delivery will give you some direction in teaching. Topics to consider are labor and delivery, newborn care, ways to prevent infection, and available resources for pregnancy, delivery, and child care. Another of your goals for promoting positive pregnancy outcomes is to assess nutritional status and teach your client some strategies for healthy eating. Assessing the adolescent mother's support system is paramount. For a teenager, pregnancy introduces additional physical and emotional stress during an already stressful developmental period. Teenagers are commonly impulsive and self-centered and do not plan for the future. For this reason, often children are born to teen moms with poor physical and emotional support and are at higher risk for abuse and neglect. Excess financial strain for clothing, feeding, and sheltering the mother and the baby, as well as child care costs or altered employment or no employment, compound the stresses associated with pregnancy and motherhood. By providing education and resources for community support to the pregnant adolescent, you can help her reduce the infant's risk of abuse and abandonment and failure to thrive. When a pregnancy is carried to term, your pregnant client and her fetus have had plenty of time to prepare for birth. Both have adapted physiologically, the client for labor and the fetus for life outside the uterine environment. Labor is a series of intense physical and emotional processes. It is your role to make sure everyone is closely monitored: the mother, the fetus, and the family unit. Several weeks before the actual labor begins, your client will begin to experience the physical changes that alert her to the approach of labor. Many factors affect the process of labor and delivery, but it might help you to remember the most critical factors as the 5 Ps: the passenger, the passageway, powers, position, and psychological response. Conditions that impair any of these, such as maternal fatigue or shoulder presentation of the fetus, can impede labor. This is called dystocia, or difficult labor. Now let's make sure we know how to evaluate the 5 Ps. First of all, the passenger in the delivery process is the fetus. To help the fetus navigate through the birth passageway, a process called molding takes place. This happens when the sutures, which are the membranous spaces between the somewhat flexible bones of the fetal head, allow the bones to overlap as the baby moves through the birth canal. As a result, the newborn's head tends to appear elongated or even misshapen at birth, a condition that resolves a few days to a week later. Also affecting the fetus's progress through the birth canal is the fetal presentation, position, attitude, and lie. Ask yourself the following questions as you evaluate the fetus's ability to move through the birth canal. Is the fetus moving head first, buttocks first, or shoulder first? How has the head of the fetus entered the pelvis? Is the fetus flexed? Is the fetal head vertical or horizontal in relationship to the client's body? Okay, now let's consider how you can determine some of this information. One way is by using Leopold's maneuvers. You can use these maneuvers to determine the number of fetuses, the presenting part, fetal lie, fetal attitude, and fetal position, the degree of the descent into the pelvis, and the expected location for auscultating the fetal heart sounds on your client's abdomen. Using Leopold's maneuvers involves externally palpating your client's uterus. In preparation for Leopold's maneuvers, have the client empty her bladder to lessen any discomfort from a full bladder. Place a small roll towel under the client's right hip to displace the uterus to the left and prevent supine hypotension syndrome. If you are right-handed, stand on the client's right side facing her. Use the flat palmar surfaces of your fingers to perform Leopold's maneuvers. You will complete 4 maneuvers. First, face your client and place both hands on her abdomen, cupping your hands around the fundus or the top of the uterus. Palpate for the fetal part that occupies the fundus to help identify fetal lie and presentation. Second, move your hands to either side of the fundus. Hold one hand steady and apply gentle pressure to the fetus. Palpate the fetal back and various irregularities to identify hands, feet, and elbows. This helps identify presentation. Third, use your thumb and middle finger to palpate just above the symphysis pubis. Palpate for the fetal presenting part. If the head is the presenting part, determine fetal attitude, that is, whether the head is flexed or extended. Finally, face the client's feet and palpate both sides of the abdomen to determine the cephalic prominence. This helps identify descent, attitude, and presentation. After the procedure, assess the client's response and then assess fetal well-being. Do this by checking the fetal heart tones and by noticing any changes in fetal position. Document the procedure and discuss the results with a physician or midwife. Now here's a question. Once you have identified the fetal position, lie, attitude, presentation, descent, and presenting part, what other information can you obtain from Leopold's maneuvers? You can use Leopold's maneuvers to determine the expected location for auscultating the fetal heart sounds on your client's abdomen, as well as the number of fetuses in the uterus. Okay, let's now go back to the birth passageway, or the birth canal. It consists of the bony pelvis and the soft tissues of the cervix and vagina. The size and shape of the pelvis helps determine how much room there is for the passage of the fetus. Antenatal measurements can be done to approximate the size of the pelvis. The cervix must have the ability to dilate and efface, or open and thin, enough to allow the fetus to descend into the vagina. The powers are involuntary uterine contractions and voluntary bearing down efforts to expel the baby. Involuntary contractions dilate and efface the cervix, promoting fetal